Hello, everyone, and welcome back to another session with DentalShadowers. Today, we have a very exciting session with Dr. Navarro. Dr. Navarro, thank you so much for joining. And on that note, the floor is yours to take away.
Awesome. Well, thank you so much. Thank you, everybody who's joining in virtually. I was just talking to our facilitators about how, you know, COVID-19 pandemic hits and we have pre-dental students all over the country that, your opportunities for shadowing essentially went down to zero. And anything I can do to help with that. I remember being in your shoes. That was a while ago now, I had my first shadowing experience, I think 24 years ago. So I know where you are right now, and I'm happy to help. Let me do this. I did prepare a PowerPoint. Let me share that and we'll get going. I do like to, whenever I'm giving a lecture or anything, I do like to have open discussion. I know this format is not such that we can do that, but if you want to enter questions in the chat, if we got a lot of them coming through, our facilitators are going to jump in. I really like back and forth discussion versus just lecturing. Hopefully I've prepared some things that are informative for you. Looking back again, thinking of myself as a pre-dent and what I was looking to gain out of shadowing experience. And so I've really put this lecture together kind of through those lenses. I don't want to overwhelm you with too much, dental jargon or anything like that. Just want to give you a glimpse in the life of what I do day to day, which is very interesting. I am a general dentist, as you can see here. I don't know what I'd be doing if I wasn't a general dentist, because I'm somebody who kind of gets bored easy. I like to be doing a lot of things at once and be all over the place. It's kind of my comfort zone, kind of controlled chaos type of thing. And so that's where I sit. Hopefully I can present to you a perspective that's, I don't want to say unique, because I think every dentist is unique, but really give you a glimpse as to, what being a general dentist can do for you and one angle you can take. So my journey, what you'll see is I really don't put a lot of stuff on my PowerPoint slides. Again, just like to have open, easy discussion. We're all human beings. I remember being a pre-dent and going to conferences and things like that and feeling very nervous to ask questions and, just feeling like I was the low person on the totem pole. And looking back, that's not the way it is, especially in dentistry. It's a very open profession, a very noble profession. So if you continue down this path and you enter the field of dentistry, I applaud you. There are a lot of things you can do, both for personal gratification and, just for humanity in general. So I'm from Visalia, California, sort of the middle of nowhere in California. Not what most people think of California as far as beaches and things like that. I live in a farming community right in the center of the state. We like to say we're 2-3 hours from anything, so we can get to the beach, we can get up to national parks. There's a lot going on, definitely a lot of agriculture. Like I said, born and raised here, finished high school a semester early, just wanted to figure out life and figure out what my next steps were. That's when I had, I think, my first shadowing experience, which I think it was 23 years ago, maybe 24 now. But I went to community college for 3 years, again, just trying to figure out life, figuring out what I was going to do. I did work full time and go to school full time. So I think the stress and the rigor of that helped me in preparation for dental school for sure. And then when I went to college, I didn't move too far, about 40 miles north to a city called Fresno. I went to California State University, Fresno. I got my bachelor's degree in physiology. But as you can see, I took my time. It took 6 years to get my bachelor's degree. At the time, I thought maybe I was dragging my feet and taking a long time, but I was working full time, learning business and things like that, which in the long run became very valuable for me as a dental professional and also going to school. So at that point, when I did get into dental school, I did apply twice. The year before I finished my bachelor's degree, I threw some applications out, got some interviews, kind of got my feet wet as far as the interview process and really understanding how competitive it was to get into dental school at the time, which now it's even more competitive. The first year when I applied and I didn't get accepted, it was quite a bit of heartbreak that came with that, because I was at the top of my class, always dean's list, president's list, had great experience, had great mentors, just didn't quite make the cut. And so that was a very humbling experience, but I would do it again in a heartbeat, because I think the following year, number one, I'm glad I finished my bachelor's degree. I don't know if there's a lot of schools now that will let you in without a bachelor's degree, but back then you could do it. And I think it was really, God telling me to slow down a little bit and kind of enjoy life and figure out the things that mattered. Yes, my career mattered, and it is a huge part of my life now, but had some life experiences that occurred in that year of going through applications again, and that I would never give back. So everybody has their own timeline. That's kind of the point of that story there. You shouldn't feel like you need to do something on a specific time frame, or that there's a perfect time for anything. The perfect time is your time. And if you look back and kind of embrace all of the years, all of your struggles, all of the hurdles you had to overcome, it does make you a better person. And so I would go through the heartbreak of getting all those rejections in the mail again, because I really grew up in that year. I think I became a better person. I became a better father. My son was very, very young at the time. I wouldn't trade it for the world. But when I did get in, I ended up going to AT Still University in Phoenix, and our Phoenix campus, and I loved it. I had never been out of California before. Went from a small town, well, relatively small town, about 100,000 people in our town at the time, to the metropolis of Phoenix, Arizona, living in the suburbs there, experiencing big city life and becoming a dentist at the same time. I'm still very heavily involved with AT Still University. I am currently a member of the board of trustees, so a group of 17 people that run the whole university. It is most of you are probably familiar with the university, but it's a solely health science university. We have 6 different schools, 2 medical schools, 2 dental schools, an online school, PT, all different schools. But very, very fortunate that I went there. I think I became who I am at that university. At the Arizona Dental School, we really focus heavily on community health and community service. There, I also received a great amount of training in providing dentistry for patients with special healthcare needs. And that is one of the things I really pride myself on being able to do, because there aren't a lot of general dentists that have their practice open to patients with special needs. And that's something that myself and my colleagues are trying to correct, actually, over the long term. But that was dental school. Then after dental school, I came home. At the time, the university had developed a satellite campus actually in my hometown, which was awesome. I got to work at a community health clinic that was a part of that partnership, and I spent almost 9 years there. And I did all sorts of things, and started going down the administrative route. At one point in time, I was only doing dentistry about 4 hours a week. The rest of the time, I was actually a medical administrator. So I was running medical clinics. I had doctors of all different specialties, including dentistry, but in medicine as well, reporting to me. And I was running clinics and managing numbers and budgets and all of those things. And that's when I decided to get a public health degree. And so I entered a hybrid program. It took 3 years, but I got a master's degree in public health from University of North Carolina at Chapel Hill. Spent a little bit of time in North Carolina, a little bit of time at home, and all the while working full time. So kind of one of those people that I'm always keeping busy. As I get older, it's become very important to me to slow down and take time off and things like that. But really, it was general dentistry that brought all of these things to my life. And I, I really think that general dentistry is the best profession out there because you can literally do anything. Um, like I said, I mean, I've worked in medical clinics. I've had doctors report to me. We'll talk about it in another slide, but I run a consulting business where I do public health consulting. Um, I am a faculty member and director for a family medicine residency out of Pennsylvania. Me and that group are developing an AEGG dental residency as we speak. So honestly, I feel like becoming a general dentist got rid of any limit that I felt in my life as a professional, because you really can just take it. You're a healthcare professional and you can do whatever you want with that. Looking back, as far as being a pre-dental student, advice that I would have wanted to hear is this list right here. Obviously, everybody knows you have to work hard. That goes without saying. If you're going to be a high-level professional, you have to work hard. But in that hard work, I think sometimes you can lose focus on your ultimate goal. And that is important to look at the long run, because sometimes when you're grinding it out, you're taking a bunch of classes, working at the same time. Finals week, you're probably like, why am I doing this? But there's an end result that you're working up to. It's kind of like training for a marathon. Some people that do marathons, when they first started out on their journey, they couldn't run a complete mile, and now they're doing an event where they're going 26.3 miles straight. So focusing on the goal and always just kind of taking a step back and reminding yourself, okay, this is why I'm doing this. This is why I'm on this path. And also in that focus, reevaluating, is this the path I want to stay on? Because ultimately you're put on this earth for a purpose. And if you figured out that this is your purpose, then just don't stop until you get there. One thing that is extremely, extremely important is making connections, like participating in something like this. I would love it if every single participant of this event reached out to me at some point within the next month. Because number one, like I said, I'm very heavily involved with a health science university. We have 2 dental schools. Can't promise anything, but if you were applying to one of our schools, a recommendation letter from me might help you out quite a bit. And those are the things that when I was talking about the year where I thought I had it all together, I was ready to go, it was going to happen, and I got rejected from all of the dental schools I applied to. I think I only got 2 or 3 interviews. That was very humbling. But the next year, when I got that call from our admissions dean saying, hey, I want you to come here, he literally told me, he said, last year we didn't know who you were and we couldn't find anybody that knew you. And we know you now because you spent a year staying in contact with us and you came back for an interview. So that's why we're accepting you. And so it in some ways it's unfortunate, but this is kind of the way it works, is, who goes a long way. And at this point in time, I think probably every state, all 50 of the United States, and Puerto Rico, I can pick up my cell phone right now and reach out to a dentist in one of those states. It's because, again, once you get into this field, you meet people, you travel. As I mentioned, I'm from kind of a little farming town in California. Never had really left the state until I was around 18 years old. Now I've been all over the world, and it's dentistry that did that for me. And meeting people along the way and having people that I can rely on if I need help with something, and they can rely on me, that goes a long way. So participating in things like this is huge. There's a huge upside to this. I know this was all kind of created or I assume was created in response to there being no opportunities during the pandemic and the onset of it. But really, this is on YouTube Live. Anybody in the world can be connected with us right now. and talking about general dentistry. So that's awesome. Keep it up, and keep in contact with your connections, because that's one mistake I made early on in my career. Was I'd participate in things like this, and then I wouldn't follow up. And I think about how vast my network of colleagues is right now. It could be even bigger. Had, in the early years, I was brave enough to just make those connections, because at the end of the day, like I said, we're all human beings. My resume is pretty long at this point, but whatever. I'm just a regular guy, who happens to love what he does and be in dentistry. So definitely focus on those things. Following up and building that network is huge. The other thing I really want to express to everybody is self-care. I'm a big advocate for mental health. I really kind of took on this soapbox, if you will, when I was a healthcare administrator, and working in public health clinics, and just seeing the need that's out there for people to focus on your whole body, and that includes your mind and your spirit. One of the best things I ever did was introduce a mental health professional in my personal care team. Especially in dentistry, when I look at all levels, from pre-dent to dental school to being out of my career, figuring things out and growing, it is extremely stressful. And especially at your level, you're focused so much on perfection. You got to get that perfect GPA. You've got to have the perfect application. You got to do all these things to get into the school. Every school you're applying to probably has at least 2,500 other people applying for that class, and there's 50 to 150 people going to be accepted out of that group. So that's really stressful. End of the day, you got to be nice to yourself, and you got to take care of yourself, because if you're not taking care of yourself, you're never going to be able to completely take care of other people. And again, that's your end goal. So just keep those things in mind, because it's very important. Give yourself a break. I remember, I'll tell you a personal story. Okay. I had the whole anxiety of getting rejected from all my dental schools. Got my acceptance, was moving into my apartment in Phoenix, and I still hadn't received my final grades from my last semester at Fresno State. At this point, I was accepted. That wasn't going to go away. The school didn't require a bachelor's degree at the time, but I had this histology class that was so freaking hard. It was so hard. There were like 5 of us in the class, one of the most advanced classes in the university. I thought it would look really good on my resume. I bombed in that class. I was at risk. And now this is somebody who was in the top 10% of a class of 25,000 people at my state university. I just, it wasn't connecting. And the tests we took were odd. That was at a time when, I'm showing my age here, but learning was transitioning from, books and paper to online. And the professor was practicing. He was like figuring out how to learn digitally, and it just wasn't speaking to me. And I almost failed the class. And here, like, I had gone through my graduation ceremony, sent out, all my announcements for graduation, and, that I was, graduating this certain tier of honors, this and that. And I was like, holy crap, like, I don't know if I'm going to pass this class. And I remember sitting in my empty apartment. We used to have to call and like plug in our ID number, and this recording would like tell us what our grades were. And I was so excited because the lady's voice, little robot voice, said I had gotten a D in the class. And I was like, at that point, I had a lot of perspective, because, it's the one true blemish on my transcript, but I think I value it the most because it gave me a dose of reality, as far as, what, you can trip and fall sometimes, but if you learn from it, it's all good. Seriously, the next semester, I was like kind of like the teacher's aide for the histology class in dental school, because even though my grade, what it said on paper didn't match my knowledge base, I was able to go and perform at the next level. So again, like, be nice to yourself. You know, if you trip and fall, get up, brush yourself off, and keep going. From my perspective, as you know, a healthcare administrator, practice owner, um, school administrator at this point, uh, I would much rather have either a student or an associate come under, or a resident come under my umbrella that has had some life experience and is able to brush themselves off and keep going, than somebody who's never had that experience. Because when you are in dental school or trying to get into residency or looking for a job, if that's your first time stumbling, it could be catastrophic for you and really set you back. So be nice to yourself. Okay. So general dentistry to me, it's I'm checking the time here. I'm kind of rambling. General dentistry to me is whatever you want it to be. As I mentioned, I have been a clinic administrator. I'm currently a practice owner. I'm a partner in 5 different dental practices. I only practice out of one. I practice at this point about 3.5 days a week. The rest of my time I am consulting, I'm teaching. My family medicine residents are all over the country. So I've been teaching on Zoom for a good 5-6 years. I'm in California. I'm starting a dental residency in Pennsylvania. So I'm gonna be going back and forth a little bit for the next year or so, getting that going. But it's all because a couple of things. Personally, like I said, I like to mix it up. I like to stay busy. I like to stay moving. Um, my fiance is sitting right over here. She can attest that, you know, if it's kind of bored, kind of slowed down time here at the house, like I might just get up and start pacing because my mind is just kind of always going. And general dentistry does that for me. You can do whatever you want, whenever you want. At this point in my career, I'm blessed to be able to say that, you know, I can work whenever I want. You know, sitting where you're sitting now, it might be kind of hard to envision that, but if you keep going, you'll get there. And so as a general dentist, you can do anything. Like I said, I've been a practitioner, teacher, consultant, practice owner. I've been an associate at private practices. Being an administrator was fun for me. I got kind of burnt out because the clinic system I was working in became very political, very bureaucratic, and end of the day, I just wanted to help people. Kind of a personal story. It's a community health clinic that I visited as a child. I come from pretty humble beginnings. And so it was nice to be there, be a practitioner, and be part of the system to kind of help people that, you know, I wore their shoes at one point in time. But at the end of the day, I decided that, you know, my core is being a dentist and being a general dentist. So I needed a little bit more of that in my life. And that's when, you know, decided to move on and joined a network of dental offices. You've probably heard about it, called Pacific Dental Services. I am an owner doctor. So I'm partnered with them as a large group. And so I do have still some administrative responsibilities because I do have 4 practices where I'm a partner, but I don't practice in those practices. So a little bit of everything. It's fun stuff. What does a typical day look like? This is the what we call the snap board for my office. This is, I think, next Tuesday. So there are some empty slots there for my associate on the left side, Dr. Malera. So I'm the senior partner in this office. I own the biggest chunk of equity in it. Essentially, I've been there the longest. And my patient base is the largest. So right here, these 3 columns in the middle, that's me. My schedule is usually pretty packed because there's a lot to do. Like I said, I've gone down to 3.5 days. So we always want to make best use of our time, and finding a balance with that. Sometimes like it's a little too much. You know, I've got a lot of exams. You can see down in the middle, I'm doing some CAD/CAM crowns. On the right side, you see Dr. Olson in the last 2 columns. He's our endodontist. So I'm the lead dentist, general dentist in a multi-specialty practice. And so we have the general dentists that are there. There's 2 of us full-time and 1 part-time. And once a week, we have our endodontist come in every Tuesday, try to make best use of his time. So you see a lot of patients on his column. Our hygienist, right in between Dr. Olson's schedule and mine. We keep her schedule light like that because a lot of these things that say continuing care or new patient, she's jumping in and doing their cleanings or their root planing. So, every one of these squares is an individual person that is coming through our doors throughout the day. And so there's a lot going on. It can get busy and hectic. It can be tiring. Physically, that's another thing I didn't mention. You want to take care of your body, okay? I kind of like to use Tiger Woods as an example. I know he's had a lot of struggle recently, but he kind of changed the game of golf. And before, you used to see golfers kind of heavy set, beer belly, Tiger Woods came on, started dominating. And one of the main differences was taking care of his body and really seeing himself as an athlete. I'm not saying you have to have an athlete body to be a general dentist. I definitely don't have an athlete body, but you really do need to take care of yourself because now, I've been practicing nearly 14 years. In my early 40s, my back is starting to feel it, being hunched over chairs, even with ergonomics, having loops that force us to sit in the right position and everything. It is a very physically draining profession. So that's another thing I probably should have put on the earlier slide is, take care of your mind and also take care of your body, and you'll have a real good kind of long run in the profession. But that's kind of the chaos of what our average day looks like at the dental office. But end of the day, we get everybody through. I have an excellent team, both in my front office, my back office, that help keep things efficient and running smooth. And, we have a lot of success. I'm very fortunate. So complaints do patients present with? This is pretty much the list for my office. I do see a lot of emergencies. As the senior doc, as the doc who has the most experience, we'll talk about it in a little bit, but we really like to do a lot of same-day dentistry in our office, and I'm the one who has the most experience with that. So most emergencies, I see those. And the 2 cases I'm gonna present to you are solely based on emergency. Chronic care, when I say that, we here in our area, unfortunately, one of the highest populations in the country for chronic illness, like diabetes, heart disease, things that can affect your gums and the oral cavity, and also for drug abuse. So opioid abuse, methamphetamine abuse, which just wreaks havoc on the oral cavity. So a lot of my patients, I like to call my chronic care patients, are folks that maybe need something done on every single tooth in their mouth. That might be even removing all of them and restoring. I do have I like to consider myself a true family dentist. And so my youngest patient is about 4 months old. My oldest patient is 102. I do open my practice to every single person. So my geriatric patients, special needs patients, everybody's welcome. So that's where, continuing care, routine maintenance, that's probably about half of my day is just being part of essentially somebody's family, and making sure that I can do my best to keep them healthy. So that's a pretty good snapshot of what our practice is. General dentists perform anything you want. So in most states, every state has a little bit different Dental Practice Act and different rules that you have to follow as a dentist. But in most states, if you have a general dentistry degree and license and no specialty certificates, you actually have a license to perform any procedure in dentistry, even the specialty procedures. The only caveat to that is if you're doing, say, an endodontic procedure, a root canal. If something goes wrong and the patient complains to the dental board, you are going to be held responsible for holding the same standard as a specialist. So somebody with a specialty certificate. For some people, that's a good thing. For some people, that's a nerve-wracking thing. I know plenty of general dentists here in town that really spend their entire day doing checkups, fillings, and maybe some crowns. And they love it. They do very well. Um, they have a fabulous time doing it. They refer all the other stuff to my practice. And that's fine by me because I like to mix it up. And I do a lot of surgery, a lot of endodontic procedures, orthodontics. I use Invisalign in my practice. I like to mix it up. But really, again, you can do what suits you as a general dentist. Some of the more up-to-date technologies out there. One big one right now is salivary diagnostics. There are lots of tools out there where you can take a sample from a patient and really break down the content of their oral cavity. Bacteria, viruses, fungi that live in there naturally. What is the mix? What is the genetic makeup of these bacteria, and how you can use this information to introduce preventive measures to really look ahead and avoid some disease states. That's a huge thing. We're in baby steps right now in my practice in introducing this, just because we have so many other things going on. With radiographs, they've come a long way compared to when I was first shadowing as a pre-dental student in junior college. Big one is cone beam technology. So using radiographs and CT technology to make a 3D image for your patients and be able to really show them everything that's going on in their mouth. And to me, the best diagnostic test is a clinical exam. What you'll see as you move along and you get into dental school and then you move on to practice, everything you're doing to prep for dental school and on, you're going to be applying to your practice. I do a lot of dental implants and I have a bachelor's degree in anatomy, and physiology. And I rely more on the dissection and evaluating the physical space that I can see with my eyes more than cone beams or any radiographs or any tests that can be done. And I'll kind of show you that here in a sec. Newer stuff out there, laser dentistry. I use lasers a lot, mostly for soft tissue cutting, stopping bleeding during my surgeries. We talked about cone beam and 3D images. CAD/CAM dentistry changed my life when I started learning about using an intraoral camera to create a 3D model and mock-up of what's going on with my patient, and then using that to make a crown or a filling, or to create a restoration for an implant. And we're going to talk about those things here in a sec. Oh, I forgot to insert my specialty at the top of this slide. Sorry for the error, but as a general dentist, and somebody who's shadowing, if this is your first exposure to dentistry, this list of words here, if you can kind of take a screenshot of that or just write them down, these are things you're going to hear a lot and are really the nuts and bolts of general dentistry. And kind of want to, for the sake of time, keep moving on because I've been talking a lot. I really want to show you these cases. But again, I really want this to be just an intro between you and I. And I would love to spend some time talking in more detail about any of these things with you. So case one, this is a very, very typical case that I personally would see in my practice. Like I said, I'm the most experienced doc in the practice. And I really thrive on cases like this, where somebody comes to me and they are feeling the worst they've ever felt, maybe as far as their teeth are concerned. And I think this is there's a personal drive to this. When I was young, when I was 9 years old, actually, I was playing football and I had an accident, and my four front teeth on the top came loose, and essentially they were out. They were just kind of hanging there. And that, you know, at 9 years old, catastrophic, life-changing event. I'm thinking I'm not going to have teeth. I'm not going to be able to smile. And the pediatric dentist that was nice enough to come in on a Sunday afternoon and help me out. And really, you know, that's was my first exposure to learning about dentistry. Changed my life, you know. And he's long passed away. His name was Jacques Peterson, but I always hold a special place in my heart for him, because I think he planted the seeds of dentistry within me. But this patient came in, broke my tooth off. What you can see here is the broken tooth. There's sort of an orange material in there. This patient has had a root canal. So the nerve was taken out, and he had a cap put on this tooth. And over time, he got some decay under that. You can see the tooth next to it. It's getting dark. You can see the roots. Same thing is happening with that one. So what I did with this patient was, you know, he went from this to the next thing you get, or the next few things. Had him out in 3 hours, but totally changed everything. And he went from one of his worst days ever to, hey, not so bad. What we did was this broken tooth, we drilled in the center of the tooth, and we put a carbon fiber post in there, kind of a reinforcing rod, rebar, essentially. And we built up his tooth. So put some resin there. I modified the shape of the outside so that I can get a crown to grip onto that. And we also cut off this other crown that was a little discolored. We're seeing some decay going on. Took a 3D image, and we used our CAD/CAM machine to build a couple of crowns, mill them out from solid porcelain blocks in the office. And that's what he walked away with. So again, going from this, oh my gosh, what is going on, to being able to walk out like that, that's huge. And these are really, I'd say, if I'm sitting down with a patient, actually, you know, not doing an exam or something like that, and cutting, you know, cutting the teeth or cutting the gums, these are the typical cases that I see. And this is what I really thrive on. A lot of the more routine stuff, nuts and bolts stuff, I tend to pass to my associates, because again, they're there more. They're still building their practices, building their skill set, and I'm there to kind of do the finishing product type of stuff. So this is a very exciting case. This patient came in on a Saturday morning. It was about 10 o'clock. We had him out by 1 o'clock. So there's some really cool things you can do in dentistry now. There's another case. So this patient, he had, I think he'd gotten drunk the night before, something like that. He fell down, and his front tooth came loose, essentially. But it had been quite some time since he had visited a dentist. He was suffering from some gum disease. You can see some of his teeth here. You can see the roots. There's a lot of plaque buildup. He had a lot of things going on. I don't have an x-ray of this slide, just because I have a lot of slides on this case. I want to kind of blast through them for you. But he had lost a lot of bone around this tooth, and his, you know, drunken fall just kind of sent that tooth over the edge. But if you look from the inside there, you can see that the gums had receded quite a bit on that tooth, and it was on its way to becoming loose anyway. It didn't necessarily need to take, you know, him stumbling and falling. So that day, we took the tooth out, pulled the gums back. You can see a lot of that root is exposed. And so this is a case where we're going to need to do what we call ridge augmentation. One of the best things that's ever happened to dentistry is our ability to guide the growth of the jawbone and make an impact on how we can fill that space. You know, back when I was a little kid, and, you know, I had my own stumble and fall. I wasn't drunk, but, you know, butted heads with somebody in football like that. That's what my front teeth actually looked like. All four of them were kind of hanging down like that. I didn't have that bone loss, of course, but, you know, same thing. At that time, I wore braces for, I think it was about 6 months or something like that, and everything's still in there. But with this patient, this tooth is a goner for sure. The x-ray showed that really, there was nothing we can do to save this tooth. So took it out. Pretty big defect in his bone here, but we have bone grafting. Okay, so what you're looking at there, it looks like grains of sand, maybe. That is human bone. So somebody who passed away and donated their organs. Many people donate their skeleton, and there are companies out there that will take that tissue, grind it up, and essentially cook out any soft tissue, any cells, any DNA. And literally, this is just the calcium and phosphorus crystals of somebody's bone that they grew with their body. We moisten it, we pack it in the area. These things that you're seeing along the edge that look like pieces of paper, that's collagen. Again, collagen that typically is harvested from an organ donor, the collagen around their heart. As you put a little collagen in there, you protect it, you build it up, and sew it up. So you can see my collagen on the outside. You can see a couple of stitches. We fixed up that defect. The really cool thing, this is also somebody that I got him in and out. What we did was we took his tooth that I had pulled, cut the top of it off, routed out the inside, and we just glued it on. We put some resin. And so he's able to heal. It takes about 3-4 months for this bone graft to heal and really become a part of the body. But he left with his tooth in a much better spot than when he walked through the door. And you can see here where I just ground out the inside of that tooth and made just a little shell to protect this man's smile and also protect his surgical site so he could heal up nicely. Several months later, he came back. As that soft tissue was healing, we kept bringing him in and taking off that tooth and grinding it down more and more and more as everything healed. So it does look a little bit different at this point. But this was on surgery day for the implant. So that's what his bone looked like. Much better, a lot thicker. Someday, if we ever do a lecture on dental implants, I can go into much more detail as to why you need a lot of bone there to put a dental implant in. But I got a nice implant in. He's got a lot of bone surrounding that. Once again, we sew him up and put that temporary back on there. Here's the restorative phase. So after 3 months of healing, he came in, this little thing here sticking out, that's called an ELOS scan body. So using 3D imaging technology, we take a scan, send it off to the lab. This little thing connected to their implant has markers on it. So the lab will know exactly where his implant sits and how to make the tooth that we're gonna put on top of it. Here we can see it all healed. This is what we call a good tissue response. So nice thick gum tissue, and the implant is down at the base. And that's his final product. And he has an intact smile. Now he has other things we need to do. You can see his gums look a lot healthier at this point because we've been doing other work on him over, this was a start to finish, a nearly 7-month time frame, but really made an impact on this man's life and made him a lot healthier. So that's just a quick, we are running short on time. We got 15 minutes and I do want to leave time for question and answer. Quick couple of cases that's very typical of what I do as a general dentist is I take on cases like that and I try to make as big an impact on the patient as I can. My biggest advice for you is right here. Just be yourself. When I was trying to get into dental school, when I was trying to get into the profession, I spent a lot of years wasting time with the wrong mindset that I had to be something that somebody else out there wanted me to be. My career blew up and got to where it is today when I decided the most important thing to be is myself. I've been put on this planet for a specific reason, as have all of you. So just embrace that and go with it. We all have our own path. We all have our own time frame. Took me 10 years to become a dentist. I know some people that were in my class, it took them 6. you know, um, we all have our own path and it's all good. Work hard always, but give yourself a break, both mentally, physically. Something like this to me at this point is a break, because it's um I'm helping somebody else out, and that feels good, because I've had so many people along my path kind of take me under their wing and show me what can be, and inspire me. Hopefully I did a little bit of that for you, but like I said, I really want to be part of your network. um, because as much as you need people in your network, I need people in my network. I have plenty in my network now, but there's never enough as far as people and people that you can lean on down the road. Okay. So with that, um, here's my Instagram handle here at the bottom. Reach out to me. You know, I if you reach out to me on here, I'll give you my direct contact info. I don't necessarily want to put my personal email and phone number on YouTube and have just rando people trying to sell me stuff and everything. But definitely take advantage of knowing people. Okay, because it's gonna just make your life so much better. And it's not, that wording is kind of misnomer or whatever. It's not taking advantage. It's seizing opportunity. There's a reason why we're all connected right now in this moment. And even if somebody's watching this on YouTube in a month, there's a reason for that. I'm a true believer that there's a reason for everything. And so might as well run with it. So with that, it looks like we have a little over 10 minutes. I would love to entertain some questions. And like I said, you can always connect with me offline. I will get back to you as quickly as possible. I'm not as active on Instagram as I used to be, but at least once a day I check it and I check my messages. So, feel free to reach out.
Dr. Navarro, that was extremely inspiring. Thank you so much.
Cool.
So
Good.
Leah here is gonna go ahead and read some questions from our YouTube chat, if that's okay with you.
Okay. Absolutely.
Yeah. So the first question says, when you reapplied, what did you do differently from the first time?
I'll tell you the one thing I did differently. I didn't care. Honestly, I did so much cutting and pasting. I put almost the same exact application forward the two times. When I say I didn't care, I presented differently at my interviews the second time, because especially when I went to the one with my university, because when I went out the first time, I fell in love with the place. I knew it in my heart that was where I needed to go to dental school. So that was the last rejection I got. I had even pushed out some interviews waiting to hear back from that school, which, looking back, who knows, I could have gotten into those other ones that I interviewed earlier, whatever. So I kind of had a little bit of a chip on my shoulder when I went back the next year, because I was like, these people rejected me. I don't know why they're calling me back. And so when I went into my interview, I felt like I had nothing at all to lose, because I had already lost whatever I thought I had lost, and so I don't want to say I came off as arrogant or anything like that. I had already felt the hurt of getting rejected by that institution. So I wasn't worried about anything. And I just went in, and I remember both interviews very clearly. And the second time, it was more of just a conversation. And, hey, this is who I am. If you want me to come, I would love to come to this school. If you want me here, great. That was kind of my attitude. And so really, that's the only thing I did different, was I changed my mindset, and it produced success.
Did you do like any more like shadowing or volunteering or anything that would look different in your application?
No, nothing at all, other than finish my bachelor's degree. But at the time, I hadn't even finished. And like I said, by the end, I was at risk of not even getting the bachelor's degree. So, really, the year, and it was April. And so I did interview late at both times with my specific school. It was April, both years. And so nothing more had really changed. My GPA didn't change all that much. I did take some more advanced classes, but my shadowing, I had one specific dentist that I shadowed all the time. Really good friend of mine. He's still practicing. Still inspiring me, you know, all these years later. But yeah, nothing really had changed other than my mindset and not being afraid to fail. That
Right.
was the biggest thing. I think my first interview, I came off as just like, you know, maybe untrustworthy. I don't know, because I felt like in answering questions, I was like searching for the answer. I was trying to like get physical cues from the interview panel, things like that. The second time I wasn't worried about failing because I had already. So like,
You were just
okay,
yourself, being yourself.
yeah, exactly. So that was the main thing.
Alrighty, next question is, do you have any advice for the interviews?
That would be the advice. Just relax. Because to me, you know, going in, looking back, the first few times I went through it, I felt like I was having to become something that these people wanted, right? But your relationship with your dental school is like any other relationship in your life, you know, whether it's a family, a romantic relationship, anything. If you are not what that other person wants, then you're not for them, right? And so you will find the dental school. One of the best pieces of advice that was ever given to me was, if you get to the point to where you're being invited to dental school interviews, 100% you will get into dental school. Now, that might be next year, that might be tomorrow, we're giving you an offer, you don't know. But if you're at the level where you're getting invites, you will get into dental school. Now it's your path. You got to find the school that's right for you. You know, the time might come where you get offered from 3 schools, but you really didn't get a good feeling deep down in your gut when you were there. You're probably better off saying, you know, thank you, but no thank you, and reapplying until you find that one school that you're connected with, because then your experience is going to be much better. I know a lot of people that have dropped out of dental school, and I really think it came down to them just not being in the right place. And so just as much as, you know, you might be of the mindset that you want to be whatever it is these people want you to be, you want your dental school to be whatever it is you want them to be, right? It's back and forth. And so that's the main thing is, you know, get to the point where you're getting invited, it'll happen. It's better to let it happen organically than try to force it.
Yes, for sure. The next question says, how do you use your dental knowledge to help your community and create an impact in the society?
That's a great question. That's a huge question. So um, I do that in several ways. So number one, like I said, being a board member of the institution where I went to dental school is a very high honor. And when I'm in that boardroom, we meet, you know, every quarter. When I'm in that boardroom, I represent the profession, and we're running an institution with all different medical fields and specialties, but I get to represent, here's how oral health impacts XYZ, right? Another way I do that is by participating in my local dental society. Um, I've been on the board of my dental society for 5 or 6 years now. Um, and every opportunity I get to take on a new position, I do it. A really good example of being able to have that voice was the last year this time when everything was shut down. We didn't really know what was going to be going on with dentistry. It's the first time in my career that I've had so many restrictions on myself as a practitioner. Um, and as things started to kind of get figured out, open up, our local public health officer uh, opened up the hospital, but didn't open up dental offices. And so myself and 2 other folks from the dental society really went to bat. And it got kind of sticky there for a while. We even threatened lawsuit for a while until finally we got to sit down with her and have a conversation about, here's what dentistry means in this community. Here's the impact that us not being able to do routine care is going to have on thousands of lives in our community, and here's what it's going to look like long term. So really being that voice, as far as, you know, everything's connected on this planet, and human beings, a huge integral part of our health is how healthy our intraoral cavity is and our head and neck. And so being able to have that voice and give that specific perspective on the community level is really, I think, how I have the biggest impact. Day-to-day dentistry, you know, that one person that I did the implant fix his smile. I like to say things like that. Like, if that's the only thing I'm doing for this person, then I'm kind of like a day late and a dollar short. Yeah, I fixed his one tooth, but if I'm not showing him, okay, here's what's happening with your gums, here's how it's affecting your whole body, here's how this can have an impact on your family if you become disabled, and, you know, this is how you're going to be able to be a productive member of society in our community, looking at it from that type of perspective, and then being able to have a platform to voice that. That's really how a general dentist can have a community impact.
Alrighty, next question is, how do you recommend we best make ourselves stand out from other applicants?
Again, be yourself. Okay. You're all taking the same classes. You're all taking the same, you know, DAT, all of those things, but not everybody, you know, raised their little sister or worked in a convalescent home, or, you know, was the, you know, the mascot at their, you know, for their college or something. Those are the things that make you stand out, because that's how you tell your story of who you are. And that's what gets you into dental school. Everything, you know, the chemistry, the organic, all those things, we all have to do it. That's okay. That's the baseline. What do you bring to the table? And telling your own personal story. We all have something that makes us stand out. And that's what, again, helps dental admissions committees know whether or not you are the person to fill the seat that they're going to offer you. So don't leave anything off. Don't leave anything off your resume or your personal statement.
And then the next question is, any advice on overcoming the fear of blood?
Keep with it. Here's the thing. First procedure I ever observed was, my mentor was debriding an abscess on somebody.
7 o'clock.
Sorry, that's my laptop.
Very, very bloody. A lot of pus, very stinky. Okay. I got lightheaded, thought I was going to pass out. But for some reason, I knew that was my calling, you know. And you saw my slides. I'm covered in blood every day, right? But it gets to the point to where you get used to it. It's also like, I do see a lot of kids in my practice. It's like a crying kid. Crying kid doesn't affect me. My 18-year-old son, we're at a restaurant, he hears a kid crying, he like freaks out, he can't deal with it. You become desensitized. So stick with it. If you get lightheaded, you get woozy the first few times, it'll go away.
For sure. We'll take one more question.
Okay.
Someone asked, can you please share a little bit about your personal statement writing or thought process?
Yeah. I did try to tell my story, but again, I kept everything service level. One of the things I think that makes me the dentist that I am is my personal experience, and my background, my childhood, very rough, a lot of trauma that I overcame, you know. I mentioned some of that stuff in my personal statement, got me through the door, got me those interviews. Again, my first round of interviews where I ended up getting rejected every time, I shied away from going deep into that stuff. But I should not have. And so in my personal statement writing experience, I did try to tell my story, but on the surface level. Um, and it worked. Like I said, I got interviews and eventually I got in. But it was realizing that maybe I should go a little bit deeper, that pushed me over the edge. And so that's what I would recommend in writing your personal statement. Just leave it all out there. Don't be ashamed of anything you've gone through. Don't be shy. Seriously, you're going to be forming a relationship you're going to have for the rest of your life. Your dental school is such a huge part of your life. So they may as well know who you are. Just lay it all out on the table, and it'll go a long way.
So unfortunately, it looks like that's all the time we have for today's session. Dr. Navarro, thank you so much for joining. That was very inspiring and very informative. And everyone, please make sure to go check out his Instagram. As he said, he'd love it if you guys build a network with him and keep in touch with him. And Dia here is going to go ahead and share the quiz link to our YouTube chat, but it can also be found on our link tree in our Instagram. So once again, thank you everyone for joining, and I hope you all have a great weekend.
Thank you so